Hello, my name is Lori Willis, and welcome to our class today. It is good to have everybody in attendance. Today we're going to be talking about discharge planning and the role of a case manager. Case management varies among healthcare settings, but for this class we're going to be talking about the hospital setting. Most case managers are registered nurses. I myself am a registered nurse, have worked in case management for 15 years, and learned a lot about the different side of nursing, as many nurses think that you don't really interact with the patient, but you really do, but you work more behind the scenes to communicate with the patient and the family regarding their current level of function and what they need to be at to go home or where they're going next. So it's a very fast-paced job, and you must plan ahead if you're going to help move this patient through the continuum of care in a timely manner. That's why it's very important to begin discharge planning on the day of admission. I've put together 4 steps. The first step is assessment. Assessment is the initial meeting between the case manager and the patient to talk about why they're admitted and how long they may be hospitalized. Also discussed is the length of stay if it's known at this time. You discuss home resources and support or obstacles that they may tell you about. This is known as a psychosocial assessment, and we will go over that a little bit later in class. Next step is planning and implementation. This is meeting with your team, discussing the patient obstacles or goals, devising a plan of care to help get the patient where they need to be in order to go home or to the next step. And last is monitoring. Monitoring is rounding as many times as needed and speaking to the family to keep all informed. This is a very big role as a case manager. Prior to discharge, the patient has teaching needs that the case manager is usually aware of and must arrange for each discipline to do their part in teaching the patient. This needs to be done in a timely manner prior to discharge, not as a just-in-time way of educating the patient, but trying to teach them as the patient progresses through the length of stay. Also, a big part of case management is medication reconciliation. You may be aware of some medication issues that the patient has, so you would share that with the physician and the pharmacist, because you do want to get the medications right upon discharge to hopefully prevent any medication errors or even readmissions due to medications. And that brings us to the discharge plan, the actual process. Like I had said, you always are planning ahead, such as faxing referrals, sending out orders for equipment, trying to assure that the patient has a safe discharge. Keeping the patient informed of the plan and documenting this in the patient's medical record helps also keep the physician informed. You will supply resources to the patient, such as a list of sitters, home health companies or hospice companies to choose from, transportation companies that can assist if they have issues there, also medication assistance if that's needed. And actually the last step in this process, I didn't really put it on the slide, is obtaining a physician's order. That's the last step. After patients go home, case managers can also be involved in the follow-up phone calls post-discharge. They call the patient to make sure they really did get the home health that they were set up for, and that they really did get the equipment, and just to kind of ask them if they got their meds filled, if they had any problems getting their medications filled. Also, satisfaction surveys are sent home with each patient, and it's very important to get these surveys back. So the case manager will ask the patient if they filled it out. If not, to remind them to fill it out. So those are a couple other roles of a case manager. In conclusion, I'd like to point out that there are some good qualities of case managers that you want to have. Team player, you want to collaborate with your team members. Leader, you want to lead among the staff, the other nurses and the other staff on the floor. Advocate, you want to advocate for the patient. And communication, this is the utmost important aspect in case management. Everybody wants to know when the patient's going home, sometimes including the doctor. And so now we're going to move on to our case study, and I just want to let you know that this case study is posted on your Moodle page, so read through it. What I'm looking for is I want you to discuss how you will plan for the patient's discharge. Think of what equipment you may need if you were the wife. Think of what concerns and education you may need if you were the caregiver or the wife. This is due in 1 week, and I do have instructions to also post 2 response post to other students. But like I said, it's all listed on your Moodle page. So that brings us to our group session. This is a sample of a psychosocial assessment where I had worked. And I want you to get into pairs. One of you play the role of a case manager, one of them the patient. And just ask these questions so you'll see how different the psychosocial is compared to a registered nurse doing a physical assessment on a patient. This is just for fun and just want to see if you can figure out most of it. Afterwards we'll discuss it, and if you have questions throughout it, I'll just be walking around to answer any questions. So I'm going to go ahead and pass these out for y'all. I'm going to give y'all about 3 or 4 minutes to go through here. So while y'all are looking through this, I'm just going to go ahead and talk a little bit about a psychosocial assessment. When you are doing a psychosocial assessment, you're developing a plan of care for the patient. For example, if your assessment reveals that your patient was prior living independently alone, and now they have a diagnosis of a stroke with severe debilities, you're going to be thinking in your mind, where is this patient going from here? You also want to look at their living arrangements prior. Did they live in an apartment on the top floor? Did they live in a camper, a mobile home, steps? Do they have transportation? This all matters when you're doing your plan of care. You're basically comparing the prior level of function to the current level of function. And you get a feel for what the physician feels like the patient will be at upon discharge. Some patients are more complex than others, and some are not very complicated at all. For example, a patient admitted for infection that resolves and they return back living independently where they came from and didn't have any needs, just maybe a few prescriptions on the way out the door, and that's about it. But those are very rare, so usually the more complex ones is who you're dealing the most time with. So I'm just going to give y'all a few more minutes to look over that. And this is also on your Moodle page, so you'll be able to print a copy if you'd like. After y'all get done with that, we're going to watch a short video I found. The video is very humorous, but really real. And I've seen this occur many times. So I'm going to go ahead and start the video.
My patient is a 78-year-old female with a history of heart disease. She is in the hospital because she fell at home during a dizzy spell and broke her hip. The patient's surgery went well, but she has not responded as well to the rehabilitation process. The physical therapist's report indicates that the patient has been willing to do exercises, but has not shown significant gait stability. Although there was no documented note indicating the need for further inpatient treatment, the physical therapist told the discharge planner and me that the patient would benefit from a few more inpatient days. The cardiologist has seen the patient and recommended increasing the dose of her antiarrhythmic medication and sees no reason why she cannot be followed as an outpatient to assess her response. He has no opposition to discharge today, especially after I told him the daughter is very involved and can monitor her symptoms. I asked a pulmonologist to stop by and evaluate her because the physical therapist says she gets short of breath easily. She ordered pulmonary function tests and a chest x-ray, but I doubt there's anything going on. The chest x-ray is clear, but the other test results won't be available until tomorrow. The social worker would like more time to plan for home visitation services, but the discharge planner notes that the patient belongs to a Medicare HMO, and it feels that the patient is stable and can be discharged. Besides, the daughter can hold the fort until the patient is seen in 1 week. Let's push for discharge today.
Patient is my mother. She has been living alone since my father died 4 years ago. I was worried that something like this would happen because I don't think she takes her heart medication all the time. She wants to be independent, but she really can't manage by herself anymore. I really can't afford to help her much financially, but she won't even accept the little I can offer. At least she'll be here in the hospital for a few more days until she's stronger and can walk. I got here early this morning to talk to the doctor. He's never here when I am. I hope he comes soon because I have to get to work. I've missed 3 days already this week, and I can't come right after work because I have a conference with Tommy's teacher, and I haven't had time to take care of anything at home.
Good morning, Mrs. A. I have good news for you. Your blood pressure is stable and your hip is healing very nicely. You can definitely go home today.
Oh, doctor, thank you. I can't wait to leave my own bed and eat what I like. This hospital food is terrible.
Well, you're going to have to stay on your special diet, no salt, low fat. I'm sure your daughter here will prepare your meals so that they follow the diet and taste good. And I'm going to increase the dose of your heart medicine. I don't want you to fall again. Someone will be by a little later with the paperwork, and then you're out of here.
My mother hasn't even been able to walk alone. Is it safe for her to go home?
She'll do fine. You can help her get to the bathroom, and make sure she doesn't stay in bed all day. She should be walking as much as possible.
But my mother lives alone. Won't she need help?
Doesn't she live with you? Well, can she stay with you for a few weeks? If you don't want to do it, speak to the social worker on the floor. She'll find out if your mother is eligible for any home care. I'm sure we can work something out.
I can manage on my own. I don't want any strangers in my house.
We'll talk about that later. And why are you increasing the dose of her heart medication? Are there any side effects?
She's been on this medication before. There's really nothing to worry about. Of course, if something seems wrong to you, call me right away.
What a nice man. I'm so happy I'm going home.
Yes, Mom. I'm glad you're going home too.
So as you can see, there's many issues with this patient going home today. The patient hasn't even walked. The daughter wasn't aware of it. There's some new medication changes. The social worker wants more days, but the case manager said they belong to an insurance company that doesn't want to give them more days. So it sounds like there's been some poor planning on the case manager's part. The daughter hasn't probably even been spoken to too much because she comes early and has to go to school. The education of the patient, for the diet of a nutritionist needs to come by and see them. So all this, taking place just in the time. Education is definitely poor risk for this patient. Very safe, and then she would be home alone. So all these issues are part of the problem with poor discharge planning. So I just want to mention discharge planning is a very important process of patient care. Discharge planning helps to reduce the chance of readmissions. It improves the continuity of care and improves the transition of care between facilities that leads to overall improved health care. So I just want to let you know this concludes our lecture today. I hope you all enjoyed it and learned a little bit about the role of a case manager. We have a short quiz here shortly, and when you're done you can turn in your quiz and you may go. I'm looking forward to seeing your discussion post, and thank you very much for your attendance, and we will see you at the next class.